racist, yelling in your face, swearing at you, trying to intimidate you, cheap-shotting you. And he would say, don't let anyone cheat you. Don't let anyone hurt you. Don't let anyone wrong you or your family. There will always be someone who will want to steal what you have. If you are rich in your heart or your mind or your spirit, that someone will see that and will come and try and steal that from you. It's inevitable, and you must be ready. And so he would say, not because I want you to protect yourself. I don't care if you get kicked in soccer. But it's because of something, and I'm paraphrasing, it's about karma. It's about the universe. You can't let a boy think that he can steal your dignity, that he can cheat, that he can bully, that he can scream and get his own way. You have to stand up for yourself. Do what is right for him and for you. And I hear him because it was a constant in my head for decades. And I'm asked constantly, what is the secret to your success? And I say, well, I grew up in Tao, our way. We go to the next slide. And really, to put it very simply, when I found this cartoon, I knew that was it. If we go to the next slide. Resilience is sometimes resistance. Don't tread on me. I will bite you. I don't know how to say that except in my father's way. And I think during COVID, I don't know about you, I actually haven't asked anyone this. I saw a lot of unfairness during COVID. I thought our communities were treated unfairly unless we were there to say, treat my people properly or else. I don't know how many times you were at the negotiating table saying, please help my people be well. COVID is amongst them. They need help, support. Vaccines are coming, vaccines are here. We need help to protect them, especially those most vulnerable. If we can go to the next slide, that'd be great. But that feeling of needing to fight once in a while persists in my mind. Sometimes I would wake up literally furious. I didn't get to ask my dad if that was normal. I did hear him say, don't give up, don't stop. Because I would say to him, I'm really tired. I can't do this for much longer. I've worked 80-hour weeks for 20 months. I have not seen my own children. I've not seen my parents. I've not seen my sisters and their children. I haven't been able to do auditions and to act as something that I love. All I've done is help look after the people. And he would say, don't give up. Next slide. And we are a part of, and this is a quote from one of the chiefs from one of the nations in the city of Vancouver, what's now the city of Vancouver in Canada. We will no longer be invisible in our own land. We will not be disregarded in our own land. I remember meeting with the chiefs in Vancouver and with the Dean of Medicine and the Dean of Medicine at our university saying, we really want to help Indigenous people. And the chief said, your university is in my territory. It would be nice if you did something helpful. That's how he spoke to the dean. Next slide. At one point, if you drew a circle, the medicine people were Aboriginal. The medicine was Aboriginal. Nurses, teachers were Aboriginal. But as colonization evolved and you looked at the circle, there were no Aboriginals. We were pushed out of our own care, pushed out of the care and protection of our own families, pushed out of the care of our own nations, pushed out of the circle of care when we all know the circle of care, all of us here, has lots of brown faces. And so include yourself in the circle. Step into the circle, please. All of you, come back into the circle. I know we've all been sitting at home, but please step back. It's a beautiful circle. It's holy work. And you are so much needed and so very, very welcome. Next slide. I'm putting this up because I'm asked all the time, what's happening in Canada? It's instructive, and I get that because I come here to the US, your health system's different than ours, and I am grateful that you invited me here. I'm not a part of your system. You're the experts in your system. I'm not an expert in your system in any way. I go to Hawaii, and I learn by being in a slightly different environment. We're not biological cousins, but we have the same colonial histories. And so what's happening in Canada, and here's a listing of some very important publications in Canada. Maybe ignore the older ones and go for some of the newer ones, including the Royal Commission on Aboriginal Peoples, which is many thousands of pages, the Romano Report on Canadian Healthcare, Jordan's Principle, which has many extraordinary recommendations, the Truth and Reconciliation Commission, which looked at residential schools and has about 100 calls to action that are absolutely extraordinary, and the Inquiry into Missing and Murdered Indigenous Women and Girls as a start. So those are seminal documents. And if I meet a dum-dum bureaucrat who has no idea how to work with our people, I say, go and read these reports and then we'll talk. Don't make me start from zero, because I'm really busy. And so those are some seminal works that can help. Let's go to the next slide, including looking into murdered and missing Indigenous women and girls and some of the actions that we can take to protect our women. I spent the early part of my clinical career in the downtown area of Vancouver. And any woman, about a quarter of the women in the downtown east side are Indigenous women. And any woman with substance use or mental health issues living in that area is so subjugated to violence, especially sexual violence. And we don't talk about this enough, there's a whole community of men who are invested in the disrespect, disregard, hunting, humiliation, undermining of women, especially Indigenous women. And often we look to those poor women to save themselves. What can we do to help you? When in fact, the problem is these men who are so invested in degrading them. And having worked down there for 5 years, I will not take that back. Sorry, men who are feeling slightly sensitive. There are a few amongst you who are horrible people and horrible to women. We'll come back to them. I call them the bottom 10%. I don't know if it's 10%, but it's just to give you an idea. That disruptive group of men who are so hurtful to our women. And in fact, so much so that, I have many young nieces. When they go off to the cities, we make a plan so that they're protected, so that they're not exploited. We invest in young women who need to leave our homes, the safety of our homes, the beauty of our families, to go into cities so that they are protected from exploitation and degradation. Next slide. This is Joyce Echaquan. She was an Indigenous woman in the province of Quebec who was degraded, humiliated by work staff. She posted live to Facebook as she lay dying, and the vitriol that came from 2 workers at her, calling her down, being racist towards her as she lay dying, created a national uproar. And so if you get a chance to learn more about this case, Joyce Echaquan, I encourage you to do that. The next slide. In a more complete sense, there's this report, In Plain Sight, and this came out of my province, the province of British Columbia. It's called In Plain Sight, Addressing Indigenous-Specific Racism and Discrimination in BC Healthcare. It's a review of literature, correspondence and submissions involving more than 900 studies. More than 600 Indigenous people shared their experiences. Sorry, they weren't all Indigenous. Some of them were non-Indigenous healthcare workers who were working with Indigenous people who had experiences of racism along with their clients. And many of these cases were very disturbing and showed just how much our people suffer, just how much racism is bred into the system, and just how much work needs to be done. Sometimes this minimization of how racist and hurtful the system is not helpful. In fact, just last night, I heard from a reporter who was minimizing racism in the healthcare system, a white male reporter, minimizing racism in healthcare. And I had to say to him, big surprise, you're not a healthcare worker, you're white and male, you're not in the system. Of course you don't see racism in the healthcare system. I, who have been here for a very long time, know that racism exists. And your opinion is not the same as my knowledge. Thank you very much. Next slide. In British Columbia, we're trying to change the way that we practice. It's around cultural safety, cultural humility. It's around taking an anti-racist stance. I'll talk about anti-racism, but cultural humility is really accepting that we work from a particular place. So let's say I'm a doctor, I'm going in to see a patient, my patient is extremely sick, maybe she's not conscious, and maybe her family members are there. I want to speak to her, I want to examine her, and the family's saying, can you please just leave her be? She's sleeping, she's resting, she's really having a hard time. Could you show some compassion? Can you come back later? And humility is me saying, I'm not the most important person here. I have a job to do, but I will come back later. And to allow that family and that patient her quietness and her dignity, and to say, my view is only my view. My need to do my work is only my need to do my work. And maybe for the family, they have other concerns than me getting my work done. And that's all we're trying to do with this practice standard. I'll come back to it. Next slide. My province has also adopted a Declaration on the Rights of Indigenous Peoples Act. This act in my province enforces the duty to consult. The duty to consult is simply this. If decisions are being made about Indigenous people need to be in the room. If you want to come and mine in my territory, you have to come and speak to me if I'm the leader in this territory. It's very, very simple. It's called the duty to consult. It's related to the UN Declaration on the Rights of Indigenous People, and it's now enshrined in law in Canada, the country of Canada, but also in my province. So it affects the federal and provincial governments. Next slide. And so in this environment, we, in my province, are imagining a new kind of Indigenous public health. If we could put aside all of those rights-based issues and correct them and say equity and inclusion are important to us, what would we do? And so we asked the people, what do you want Indigenous public health to do? What do you want the health system to do for you? And we know that Indigenous people experience public health different than the general population. We know that we have the worst inequities of any ethnic group in the entire country. Indigenous people used to own everything, and now we own next to nothing, well, hardly anything. We come in last in almost every social determinant of health and every measure of socioeconomic status. And this is contrary to the popular opinion. I remember going toe-to-toe with a doctor who came up to me and said, you know, all that money you guys get for Indigenous health, you should give that to immigrants. And I thought, wow, she's really bold. A white woman coming and schooling me about Indigenous health. And I said, immigrants? Do you mean like you? Because I'm used to doctors saying, give us the money and we'll take care of the problems. And I thought that's what she meant. I thought she meant, give me your money. So I said, do you mean like you? And she said, no, not me. I mean immigrants who've been here for less than 6 months. I thought, oh, that's an interesting definition. And we went, hey there. Oh, great, thank you. So we went toe-to-toe, and all the other doctors in the room were acting like we were having a brawl, like a pub brawl, because they all jumped on us and pulled us apart. I thought we were speaking reasonably, but maybe we were screaming a little bit. But yeah, not today. I do not take being schooled in Indigenous health, unless it's from an elder or someone who I know has good knowledge. Let me see if I can change the slide now. Oh, I did. I just did it. Yay. So here are some very important, from our perspective in looking at Indigenous public health in British Columbia over many years, key considerations in Indigenous public health, key considerations in looking after our people. We must decolonize the system. We must decolonize our approaches. We must decolonize the way the system supports or doesn't support our people. Community and locale specific. What works in Michigan doesn't necessarily work in Seattle. What works by the ocean doesn't necessarily work in the mountains. What works in the north doesn't necessarily work in the south. Prevention and promotion versus being reactionary. How much of our work suffered while we reacted to COVID? Virtually all of it. I personally dropped hundreds of files. We're hearing now about those unattended cases, say, of cancer. Tumors were growing during COVID, and nobody was watching over them. We know our people want holistic approaches. We know that we want relationships with those in charge, not just being controlled or subjugated or dragged along, unconsulted. We'll get to you if you get in line. We'll deal with it if you're organized enough. Stories as evidence. We still, in spite of all of our work, we're still hearing stories about how our people are suffering. In spite of all of our investment, and really my organization has spent hundreds of millions of dollars trying to improve the health of our people, we're still hearing stories of people suffering, and we need to react. It's not that we're not doing our jobs, it's just that that's the terrain that we work in. Some themes that we see in looking after our loved ones in their communities, in our communities, that the colonial experience colors our health. Our health was going along in a particular way, and now we have health interrupted. Colonization interrupted the course of our lives and our well-being, and continues to interrupt our well-being. Of course, sometimes colonialism has given us some extraordinary tools, like painkillers. Oh, well, wait a minute, sorry, that was kind of a double-edged sword. Maternity wards. Oh, wait. Our women were policed when they were on those wards, and their children taken away at the drop of a hat. But that colonial experience within the healthcare system needs to be monitored. Well, first of all, we need to be aware of it, and then we need to examine it. We know that the social determinants of Indigenous health affect our lives. Things like health literacy changes a person's outcome, changes how much they suffer, changes how soon or late they die. We know that our environments are under pressure. They're under scourge. We know that the nation around us presses on our environments, seeking out our resources. We know that racism is alive and well. We need data. Without data, it's hard for us to see into our own houses. We need to be able to illuminate and look into our own homes and see what's going on. And of course, our leadership, our family heads have said our mental and emotional and spiritual well-being needs caring for. Somebody do something. And so in Canada, we've imagined a new approach to Indigenous public health. So if there's one thing that you get from today, please Google this report. If you just Google CPHO Indigenous, this report will come up. Oh, and there's my alarm saying I have 5 minutes. You'll find that report. So I'm going to skip a few slides then, because what I'm going to mention are related to that report around our environments, being stewards of our own environments, our personal stories of being in the environment, like being with my dad in a boat, being with my dad in clam digging, being with my dad and being sent into the water. Those are stories, and he would tell me when I was in those boats, so-and-so used to live over there, and so-and-so used to live over there. And those bits of knowledge are actually exceedingly important for me to catalog and to write down. There is so much sacred and holy within our territories, and we must know them. I remember my mentor in Hawaii saying to me, mainlanders come to Hawaii and they don't know this place. They never bother to get to know this beautiful paradise. And I always think, I don't want to be that person. I don't want to be in my own homeland and not know my paradise. I need to know every stone and every bird. And I need to know how the water is changing, and I need to know the weather patterns, just like when I was a kid, and that was what my father demanded. And we need a view into our house with data, and that means data matching, not us taking over our own data. Yes, being stewards, but the lion's share of the data is held by the state and is held by the federal government. It's held by our partners. We must match to them. Most importantly about data is we must count ourselves in. We count. We matter. We're supposed to see ourselves in that data. Everybody hurry up and give me more data. Everybody include me in your data catchment. Of course, I want control over that. But all of you, and I don't mean you specifically, I just mean the whole world should be giving me data about our people's health. And we must continue in our efforts around mental health. We know that the opioid crisis is stealing far too many of our people, and I hope that we will spend a good amount of time talking about that here in this conference. And I'm going to skip the slides on the Truth and Reconciliation Commission because I have talked about them a little bit already. And pass very quickly over this painful subject in Canada. We're expecting to find at least 20,000 children's bodies in residential schools in Canada. 20,000 of our children lost and buried in graveyards outside residential schools. It's very sad. It's absolutely infuriating. It still makes me angry. I still face residential school minimizers and deniers, and that is part of the work, to not have those lives be erased, to try and bring those children's remains home. And it means ceremony, it means leadership, it means investment, it means data banks, it means biological sampling, it means the cooperation of villages and families, it means talking about children who are gone or maybe even long and forgotten, and maybe some detective work. It means dealing with the fury that we're feeling and the frustration and sadness. But those children are gone now, but we must not let them be erased. And that is part of the work in Canada, lest we forget what happened to us and to our children. So I hope that you see the way forward is as simple as turning towards what needs doing. Turning towards what needs doing. Waking up every day and remember sunrise. The sunrise is eternal. There will always be a tomorrow. There will always be another chance to do this work. Don't avert your eyes. I know you're tired. Don't be sad. It's okay. Keep your eyes open and look to the work and be courageous. And I dare say that this work that we're doing isn't all about our Western skills and knowledge. In fact, we probably need, I know we need to bring our great humanity, our authenticity, and the evolved personhood that was part of our youth, our elders saying to us, you must be a good, strong person in order to survive, but also to be a help to others. I also want to say that helping each other is extremely natural. It's actually very core work. Maybe it's as core as nutrition. We're built for it. My elders used to say, you're not a dog. Being a dog at home is not a bad thing. But the elders would say, you're not a dog, you're a human being. You have a voice. We talk to each other. It's what we do as human beings. And I always remember that. As much as I feel shy sometimes, I try and remember our way. And I know that I need to decolonize my approach. I know that I need to be humble. I know I need to be a good ally, and I need to be anti-racist. But most importantly, and I am skipping ahead a little bit, because I do want to end, I'm already 1 minute over time for the Q&A. I do want to remember one elder who was looking at me, and he said, I know you're smart, but I want to see if you're strong. I want to see if you're strong in our way. Smart, I guess he was saying, didn't impress him much. Strong in our way, that's amazing. My slides are not advancing, I don't know why, but I hope that you will see the beauty of doing things in our way again, and not just see the Western way, not just see our hospitals and our clinical system, but see our elders and our traditional system of care. I hope you will see the love between us. I hope you will see the camaraderie between us. I hope you will see the fierceness and the strength in each other, not just how smart that we are. And I hope that you will remember the story of you and the story of us. I'm trying to get a handle on it, and I know that part of it is being home, not in my clinic. Part of that is being home with my family and my parents and my dad and his wisdom and the elders, and doing things that my people think are important, and not just being in the office or the clinic and doing what my colonial masters say are important for us to do. And I hope that today has been helpful to you. I'm remembering an elder of mine saying to me, I was trying to tell her how important I was in Emerge, and an old woman had asked me to go and get her some water. I said, can you imagine? I had so many difficult cases, and she made me go and get her water. And my elder said, oh, maybe she thought you were there to help. And that's what I want you to be. Continue to be great and wonderful helpers. Thank you very much. Thank you. Thank you, everyone. Oh, we're behind, so no Q&A.
All right, so we want to thank Dr. Evan Adams for all of your time, all of your amazing skill, and all of the things that you've been able to bring. I've been taking notes this whole time, just all the great things, and I'm just so thankful. And I just want to let you know that the stories about your parents will continue on. So thank you for taking time to be able to come and talk to us today and share all of your great wisdoms. And you've always been a big hero of mine. I remember whenever Smoke Signals came out, I got my shirt, and I was very thankful. And to even now, because all of the great things that you continue to do, and your message today was so powerful. So again, thank you so much. I do believe we have a small gesture for you. Thank you. All righty, one more time for Dr. Evan Adams, please. All right. Well, we're going to keep moving on. Again, we want to thank everyone for being able to make it out this morning. I know we've had a lot of folks come in, so please come in, make yourselves at home. We have rooms, we have some chairs up front, so please come to the front and make yourselves at home. But really quick, we're going to take a 10-minute break, so get a chance to check your email, do what you need to do. But whenever we come back, we'll have a quick Q&A with our other MC, and we'll get ready for our indigenous chefs. So it is currently 10:51. We will be back at 11:01.